All right, this is Joe and Colin with OKRaw.com. Today we have another exciting episode for you. We're coming at you from the 2014 Woodstock Fruit Festival. I got one of the presenters taking me aside here, Dr. Rick Dina, who's been into plant-based, 100% vegan, predominantly raw food diet now for the last 27 years. You can learn more about him at rawfoodeducation.com. And the reason why I brought Dr. Rick on the show today is to ask him, what's the 3 most important reasons somebody out there should get a blood test? I know many of you guys out there right now, whether you eat a raw diet, a raw vegan diet, or just a standard American diet, you're like, oh, I feel great, I'm healthy, I don't need to get no blood test, I don't gotta check nothing, because I'm doing fine, I feel great. So Dr. Rick, what's the top 3 reasons somebody out there watching should get a blood test?
Well, there's probably a lot of reasons, and I'm just going to I don't necessarily have 3 off the top of my head, but why don't I just start talking about some of the important reasons, and then when we get to 3, we can wrap it up, but there's going to be more after that anyway. Number 1, I would say that lab work, depending on which tests you get done and how they're interpreted in that thing, can tell an individual an awful lot about what is going on with their individual biochemistry. So something could sound good in theory. Well, this diet does this, and this is going to happen and that's going to happen, and we did a study, and the majority of the people, these good things happen, but sometimes they don't tell you, well, 30% of the time it didn't happen that way, and you might be one of those 30%, and it's good to know what works for you individually, because the health plan in general, that's one thing, but then how it interacts with you individually is a whole other thing, and lab work can help determine if you're on the right path or if you're on the incorrect path. Like, for example, most people out there will tell you carbs are bad. They make you fat, they cause diabetes, they raise your blood sugar, and spike insulin, and insulin tells your body to make and store fat, and all this bad stuff happens. And then within the raw food community, a lot of people say that fruit is bad for you, and it's going to raise your triglycerides and raise your blood sugar, and et cetera, et cetera. And that's rarely the case. One of my favorite things to do in my lab work and consulting practice is go over a blood chemistry panel with high fruit eaters when we get to their glucose level to see that their glucose is at a nice, right in the middle of the range, good low level. So there's an example where what we see individually doesn't always fit what a lot of information out there on the internet would say otherwise. Although then again, occasionally I do see a high fruit eater with elevated glucose or elevated triglycerides or elevated cholesterol, and that's not what other camps of raw food nutrition say are supposed to happen. And usually it doesn't. But if it's happening for you individually, if you go to a typical practitioner, they'll yell at you and they'll tell you need to eat meat and you're so dumb on a high fruit diet. What are you doing? And you're not getting enough protein. And this, I just talked to a nurse, one of the healthcare professionals who's been coming to some of my wife and I presentations here. And she said the one doctor who she went to got really mad at her for eating a raw food diet and dismissed her from care. So in any case, when people who are interested in raw food and vegan nutrition come to me and something's not quite off, I'm not going to yell at you and tell you to eat meat because you're not getting enough protein, but we will be able to see what's going on and make some modifications to do what works best for you individually. So I guess number 1, to summarize, it tells what's going on for an individual specifically, as opposed to what's just supposed to happen to a group in general. Number 2, you can head things off at the pass before they become a problem. So I've got some people now. So for example, I did a talk here on lab work and I talked about the complete blood count and its a relationship to iron and to vitamin B12. So if you're low in iron or if you're low in vitamin B12, either one of those things can lead toward anemia. And when you're anemic, your body can't carry oxygen around to all of the rest of your cells. Your brain doesn't work as well, your body's kind of sluggish, you bruise easily, you don't have as much energy. It's not good to be anemic. So if you're anemic, let's say you become anemic and someone tells you, oh, take iron if you're anemic, because I was anemic and once I took iron, my anemia went away and it was so much better. Well, what if your anemia is a result of B12 and you're already more than adequate in iron? all the extra iron in the world is not going to help you. In fact, it can be harmful. Iron is a pro-oxidant. It's the opposite of an antioxidant. It initiates free radicals in your body that damage your body. So a basic lab test can tell you, go down this path and it will resolve your issue, instead of going down another path, which means you're barking up the wrong tree. So I guess I have a two-part answer to number two. Number one, it can make sure you're going down the right path. And number two, it can resolve a problem sometimes before it ever even happens. So going back to vitamin B12, you can see signs even on a complete blood count, even without doing a B12 test, although you should do that also, and there's some other more advanced tests for B12 as well. But you can see on the complete blood count if you're low in B12 and you're starting to head toward anemia. And therefore, you can head it off at the pass years before you ever become anemic, and years or maybe even decades before you ever develop severe neurological problems that can happen from long-standing B12 deficiency. And then number three, maybe it's just good to know what's going on with yourself individually. It can give you a lot of peace of mind. Okay, a lot of times people say, oh, you're on a high fruit diet, you're on a vegan diet, you're not getting enough protein, you're eating all those carbs and your triglycerides are going to go up, and that's going to raise your cholesterol, and that's going to cause problems, and it's sugar that causes heart disease, not fat, etc., etc. People are all worried. Oh my God, they told me I wasn't good. I had to start eating fish. I had to start eating meat because I wasn't getting enough protein. And oh my God, raw cruciferous vegetables are bad for me and I can't eat fruit. And there's all these other things. And then people go off of a plan that was working really well for them. They were feeling great. But they changed it because someone convinced them that their diet wasn't working well. With the appropriate lab work and the appropriate guidance. I can't tell you how important the appropriate guidance is. You gotta know what you're doing, and I'm doing my best to be that clinician in the raw food community. With the appropriate guidance, it's oftentimes it adds a lot of confirmation that things are working properly. So I gave a talk here about omega-3s, and we saw 12 examples of long-term vegans without an outside source of the omega-3 fatty acid DHA that they say you need to get in fish. And all those people, myself and my wife included, had plenty of DHA in the cell membranes of our red blood cells. So if you're someone like that and you see your DHA levels are good and someone tries to tell you you need to eat fish, hey, you've got the lab data to confirm that you don't need to eat fish. And if you're low in DHA, then we can address that in a way that may or may not include fish, depending on what your interests are. So it can give you a lot of confidence if things are working well, and if things aren't working well, then we know what to do to make sure we're getting you to the optimal level of health instead of being somewhere suboptimal.
Wow. I mean, I definitely agree with that. One of the things that I've been trying to do since I almost lost my life, and I'm trying to be as healthy as I can, build my immune system. So I've definitely used Dr. Rick in the past for analyzing my blood work, and will continue to use him in the future as well. So Dr. Rick, if somebody wants to get their blood tested, how can they do that through you?
The first thing to do would be to go to my website, rawfoodeducation.com, not just mine, my wife and I's, Dr. Dina. And there's a lab work and consulting tab there, and you can click on that, and it tells you all the basic parameters about how my lab work and consulting practice works. It's pretty straightforward. You make a payment for a consult. We get on the phone or Skype. I work with people from all over the world, so even sometimes I'll meet with people at 11 at night because it's morning in Shanghai or something like that. And usually Skype works pretty well. Sometimes it can be a little iffy. But we have what I call a pre-lab consult, where I get a basic history, find out what you're eating, if you're having any symptoms or health concerns or challenges, and then based on that, I'll recommend what lab test to go get done. If you're in another country, outside of the United States, you'll have to go to a local practitioner to order different things. If you're in the United States, I can send you a lab slip to go to a local lab to get your blood drawn to perform the tests. Or I also have some labs that I work with that will send you a home kit, and you can leave collect your urine, leave a blood sample, and then mail it back to the lab. And then and I'll talk to you about the appropriateness of the test, how important it is for you, what the costs are, all that stuff ahead of time. Some people use their local doctor because their insurance plan covers it, and I'm fine with that. As long as it's reliable data, that's good. So then once the results are in, we have our second consult, our post-lab consult I call it, where I go over all of those results line by line. Make sure you understand exactly what's going on with your body individually, and then we relate that to what you're eating, what's going on, and if things look good, that's great. If something's off, then we can address that and make sure you're as healthy as possible. So that's the basic way it works. Rawfoodeducation.com gives you more details, and being a 27-year raw food vegan myself, eating this way since 1987 and enjoying the tremendous amount of benefits I get from it, I want all of you on the raw food vegan path, or even if you're not vegan, even if you're not raw, if you're heading in that direction, you're interested, you think it can make you healthier, or you've experienced it making you healthier, I want to make sure that you've got all the resources in your corner to stay on that path and stay as healthy as possible, instead of having misinformation or lack of proper guidance send you off of the path so you won't be achieving your optimal health.
Wow, I mean, I definitely agree that I believe Dr. Rick can help to fast track you on your way to health with cutting all the BS out there. He'll tell you what exactly you need to do, and if you just do it, you're gonna be super healthy, and it's gonna be great. I mean, I've taken much of Dr. Rick's advice myself personally, and it has definitely helped me in my life, and I'm confident that it can help you in yours too. So Dr. Rick, is there anything else you'd like to say before we wrap up?
Yeah, I just wanted to say one other thing. As much as I've been eating this way 27 years, have a doctorate degree, I'm a total nerd and keep researching things. I've had a lot of clinical experience in my personal practice and in past practices as a fasting practitioner for 4 years, for example. As knowledgeable as I am, I'm knowledgeable enough to know that no matter how much you know, there's always more to learn. And so I don't know everything. And if I don't know everything though, I will tell you what I can help you with and what I can't help you with, and sometimes I can refer you to somebody who can help you with a specific issue. So be careful of people who think they know everything, because nobody does. Some people don't know enough to realize they don't know everything. So I'm straightforward and honest. I want to help people, and if I'm not the right guy, I'll try to steer you in the right direction.
I mean, I could definitely vouch for Dr. Rick. Always been honest and straightforward with me, and I'm sure he will be with you also. I would definitely encourage you guys to check him out, rawfoodeducation.com. So hopefully you guys enjoyed this episode on 3 reasons why you should get a blood test. You know, my goal is to get a blood test every single year to keep track of my progress and chart my results and make changes as necessary so that I can live the life I want and be as healthy as I can. So hopefully you guys enjoyed this episode. Once again, my name is John Kohler with OKRaw.com. We'll see you next time. And remember, keep eating your fresh fruits and vegetables. They're always the best. All right, this is John Kohler with OKRaw.com. Today we have another exciting episode for you, and I'm coming at you from the bathroom to share with you guys one of my most important things you guys should be doing in the bathroom. Go into the bathroom properly. Actually, just kidding. I already have a video on that. I'll put a link down below.